We acknowledge that we are gathered on Indigenous lands, the traditional territory of the Coast Salish people, specifically the Tulalip tribes, successors in interest to the Snohomish, Snoqualmie, Skykomish, and other allied bands signatory to the 1855 Treaty 2 Point Elliott.
Welcome. My name is Debbie Warfield. We are so happy that you joined us tonight for our 4th annual A Night to Remember, A Time to Act. Today we are also honoring International Overdose Day. Recognized globally, it is a time to bring awareness of overdose and reduce the stigma around drug-related deaths and the disease of addiction. 8 years ago, we lost our beautiful son, Spencer, to an overdose. He was 24 years old. We waited several years to share the cause of his death because at the time, we did not know any other families that had dealt with this. We felt very alone, and in 2012, there was so much negative stigma around drug use. We did not feel comfortable sharing this. Most people only thought homeless people were using heroin. Spencer's life had so much more meaning than his addiction and has inspired recovery for many people. So this is why I do this in his memory. He had a huge presence in our family. At 6'5", he was a natural athlete, intelligent, hilarious, and always kept his family and friends on their toes with his practical jokes. I was fortunate to meet Kathy a few years after Spencer's death. You will meet her next. We felt talking publicly about our experiences with addiction. We hope to empower parents and families to come forward to fight for their loved ones and demand action for their recovery. I can help Spencer live on by bringing awareness to people who are just like him and Kathy's son, Corey. I would now like to introduce you to my friend, Kathy Lee.
Thank you, Debbie. Yes, welcome, and thank you for joining Debbie and I tonight as we honor loved ones lost to addiction. As Debbie said, I am Kathy Lee, and my son Corey passed away December 2015 at a very young age of 20. Like Spencer and so many others, Corey was loving, athletic, family-oriented, intelligent, honorable, and a hardworking young man that always looked out for others. He definitely was not the stereotype we think of when we talk about addiction or alcoholism. As Debbie said about Spencer, Corey was so much more than his addiction. Because of the stereotype and the shame that comes with addiction and alcoholism, Dave and I kept Corey's addiction a secret from even the closest family. We felt alone, isolated, desperate, and helpless as we navigated Corey's addiction I met Debbie several months after Corey passed away. And as we became friends, we realized there were more families like ours with a similar, if not nearly exact story like ours. Each year, we both feel conflicted as we see the numbers of our vigils increase. On the one hand, that means we are reaching people. On the other hand, that means that there are more people that have gone through our pain. We hope tonight, after watching our program, that you come away with a new understanding and respect for this epidemic ripping through our families, communities, as we share some experiences, hope, and support. Now I want to introduce our first speaker. I'm going to introduce Dave Lee, Corey's dad and my husband. I don't think you ever get over the death of a child, and it is always difficult to talk about. But when your child dies from an overdose, facing the stereotype can make the grief, all that, and all the what ifs, all that much harder. It is with respect and admiration that I introduce Dave Lee as he tells us about his experience of heartbreak, frustration, and hope.
In December of 2015, we lost our son Corey to a drug overdose. Corey was a bright, articulate, outgoing boy. When he started using, we failed to see it. From about 10th grade on, we watched him progress from one drug to the next. We tried to get Corey help many times in high school and post-graduation. His high school teachers, pediatricians, and counselors were of no help at all. When they did get him to attend counseling, he always blew it off and just could never admit that he had a problem. He usually told his counselor that he would continue to use after the required treatment plan ended. After graduation from treatment, he told us that he had met a whole new group of users and had a whole laundry list of drugs to try. Corey always thought he could handle it. One day, late in November 2015, Corey ingested a toxic mix that his body could not handle. Lying in the hospital bed in a coma for over a week, Corey's body repaired itself, but his brain could not recover, and after 10 days of no brain activity, his battle with drugs ended. Corey's with me every day. Every time I see someone in distress on the street, I think of his battle and his inability to see the reality of his addiction, and my inability to convince him that he had a problem. One of the things that sticks with me always is going to a support group where we were with people who were battling the addiction of a loved one. I realized that we are all completely paralyzed by these addictions. I felt that the group just admitted that we could not do anything about the addiction of our loved ones and that we had to wait for the addict to decide to quit. Even the prayer we recited, "Give me the strength to accept the things I cannot change," made us admit this defeat in advance. Today, in Corey's memory, I'm on the lookout for signs of addiction in my life. In our business, I've instituted a testing and treatment program and have employed many recovering addicts. We've sent many troubled employees to treatment and have helped many friends battling with addictions. I continue to confront this straight on, as I should have done with my son in the first place. Never give up. In December.
Thank you so much. Thank you so much, Dave, for sharing your grief and your story with us. Each loss is very unique, but a loss of a child is so difficult. action. It is my pleasure to welcome John Gehagen.
Thank you for joining us this evening, and thank you for giving me the opportunity to speak with you. My name is John Gehagen, and if that name is familiar to you, it might be because I'm on the Mukilteo School Board, where I've served for the past 8 years. But that's not why I'm here tonight. I'm here to tell you about my son. Sean's a bright, creative, funny, and compassionate kid. But he began abusing prescription opioids in the fall of his senior year in high school. In the following months, he received outpatient and inpatient care. And in June of that year, Sean graduated from high school, despite having missed over a month of class while in rehab. 5 weeks later, and 6 weeks shy of his 18th birthday, Sean relapsed and died of a drug overdose. At that point, I could either have chosen to curl up into a ball and cry for the rest of my life, or I could do something to try to save other kids from Sean's fate and other families from the indescribable grief we live with every day. A wise man said recently, "The best way through pain and loss and grief is to find purpose." So I decided to turn grief into action and activism to help prevent overdose. This included working to pass bills both in the legislature and in Congress to offer limited immunity to those who call 911 to report an overdose, to expand the availability of Narcan, and to establish drug take-back programs. If you have a loved one struggling with opioid addiction, I urge you to get and keep on hand Narcan. Narcan nasal spray, which can reverse the effects of an opioid overdose, is available in most major pharmacies without a prescription. And if you have any unused prescription drugs in your home, please deposit them in a drug take-back drop box in pharmacies throughout Snohomish County. Check takebackyourmeds.org for the location nearest you. Thank you for listening, and stay safe and healthy.
We are honored to have Dave and John speak about their sons, Corey and Sean. It is so important to hear from fathers as each family member is affected differently by addiction, grief, and loss. Addiction is a family disease, and it is helpful to hear the male perspective. Thank you, Dave and John, for your bravery to speak today.
Okay, our next section is going to be more around hope and encouragement. The last 6 months have been very difficult with COVID-19 for many to maintain their sobriety. The increased isolation and reduced access to harm reduction and treatment support has taken its toll. Our next segment, we will hear from community members and those who are close to the cause of hope and encouragement. Robert Smiley from the Hand Up Project, a volunteer group helping those in need find help, especially those in addiction and homelessness. In their words, they're a group of former homeless addicts paying it forward. I'd like to welcome Robert Smiley.
Thank you, Debbie. Kathy Lee. My name is Robert Smiley. I'm the founder of the Hand Up Project, and I can't tell you how honored I am to be here. I was a former homeless addict, and when I decided to get sober, one of the things that was pointed out to me is that I needed to help others if I wanted to stay sober. And in doing so, I started reaching out to families and friends of addicts and alcoholics and getting them into detox or treatment. But the problem was I couldn't get them there. I take them into hospitals, they'd be overdosing. They'd fix them up and boot them out. Stay with them for 12 hours and they just boot them right back out. That is because of events like this and family members that are realizing that this isn't a homeless problem. This is a community problem. Now we have, it's gotten to the point where we've got people that the county's allowed us to have Narcan, to be able to administer it on site, get proper training. If people want detox and treatment, we can get them in the same day. We can start giving them hope, but it was still, okay, we got you in the detox, now wait, and before we can get them in treatment a lot. We still were losing people. With organizations like myself, but also especially Lindsay Arrington with Hope Soldiers, were huge advocates for reaching out saying this has got to stop. There can't be any gaps. And then when this COVID hit, it really turned into a nightmare situation. Simply because nobody knew where they were going to go, where to turn, how to get help for these people. Everybody was afraid of COVID, so detoxes were shutting down, treatment centers were shutting down, until they realized they didn't have to. The increase for opioid overdose right now is just astronomical. It's more than triple. But we're finding there are solutions. If people want help, we can get them help. Biggest difference we're noticing is that family members who have a loved one that's an addict are starting to realize that the best people to talk to are other addicts that have overcome their addiction. As family members, we have a tendency to love our addicts to death. And we're advocates to let you know the worst place for people to go after detox and treatment is home. They need to go into community living that supports recovery base, that is going to be by their side, walk them through the process and get them given back to the community that they used to terrorize. I have hope today for the opioid situation because there's so much attention being drawn to it, and there's so many families that are being affected with their children going through this and passing on, that it's not just a hidden conversation, it's an active conversation. And that's what's doing the best for our community, because I guarantee you sober up a heroin addict, and all the gaming and scheming that went into getting their next fix goes towards helping others and being a positive member of society. They're the most amazing and intelligent people out there. This is also an opportunity to reach out to all the family members and saying, don't be afraid to reach out to nonprofits that might be able to help you. Hope Soldiers and myself will get you into detox and treatment the same day, then get you into recovery housing, no gaps. We're getting more and more phone calls from jail, but at the beginning of the COVID, they weren't taking them to jail. And even now, they're not really housing them. They're letting them right back out. If you have a child that was arrested for something like that, they don't have the fear of being in jail anymore. But now you have opportunity to say, hey, look, we know if you want to get help, there's help out there. We care. We've been there. We've done that. And I'm looking forward to working with a lot more of the families. This is a crisis, but it can be overcome if we work together. Thank you, Debbie and Kathy Lee.
Thank you, Robert. Now I would like to introduce Amy Hill. Amy is an opioid outreach specialist for Snohomish County Human Services Department, providing opioid overdose prevention education throughout the county.
My name is Amy Hill. I am the opioid outreach specialist with Snohomish County Human Services. There have been a lot of changes in the last 6 months related to COVID-19, especially with the clients that I work with, where they're looking for connection and support, and with meetings only being on Zoom, treatment being on Zoom for outpatient, there's been a missing connection and a supportive feeling of having someone in person to share with. And in addition to that, people who are experiencing homelessness haven't been able to get into stores or restaurants or any place that they've ever been able to utilize the restroom or charge phones. This epidemic is being affected by the pandemic, and it is it's hard to watch because there's still people out there that we're trying to get them into services, and there are services available. We just have to be a little bit more creative. In the midst of all of this, I have never given up hope, and I will not give up hope. There has been an outpouring of support from clients that I've worked with, people who have experienced addiction in their own life that want to give back. They want to reach out, they want to support, they're looking for ways to volunteer, offer their time, and support people who are struggling right now. And it is so encouraging to see. It's encouraging to have clients that have 2 years clean and they call and say, what can I do? How can I get out and help right now? That has been a really big encouragement in my job. I would also say that there's parts of the community that are rallying together to support people who are struggling and wanting to find ways that are maybe not the traditional ways that we've had to use in the past because they just don't work right now. And looking at grants for Narcan that we can distribute to the street and provide to people in the midst of having, you know, this pandemic going on. 3 things between addiction, overdose awareness, and this role that I play as the opioid outreach specialist is really important to me. I have met the most amazing people in this job, working with people who had no hope and how they have gone through difficult times, but pushed and worked so hard to get through and find who they are, and then to go out and be a light to other people. Overdose awareness is extremely important to me because there is this huge stigma in our communities that, you know, people who are struggling with substance use disorder are the only people that overdose, and that is just not the case. There are accidental overdoses every single day, and to have this stigma of overdosing and what it is one of my biggest passions, to educate people, to let them know that it can happen to anyone, and we need to support, not tear people down.
Next, we're going to hear from Lindsay Arrington. Lindsay is an identity and purpose specialist and founder of Hope Soldiers. Her mission at Hope Soldiers is to bring awareness, restore hope, and love people back to life. And tonight she is going to talk about persevering recovery during uncertainty. Thank you and welcome, Lindsay.
Hi, everybody. I'm Lindsay Arrington, and as Kathy said, I am the founder of Hope Soldiers, which is a local nonprofit that helps individuals and families overcome addiction and depression. I'm really grateful to be here. I'm really grateful to be speaking today, and I want to thank everybody who has joined. I want to start by saying that I don't know many people who are more resilient and more determined and persistent and committed than somebody who's been affected by addiction, whether they're in the middle of addiction whether they're in recovery from addiction, whether they're a parent of a loved one in addiction. And so, you know, in recognizing that, I want to honor those who have been affected by addiction, because whether you're in it or on the other side of it, or you are watching somebody go through it, or you are watching somebody be victorious through it, I just want you to be seen and be known, because it's not easy. And nobody said that it was going to be easy. There's no rule out there that says, hey, just stop doing drugs, it's easy. That's not how it works. And so I want to acknowledge that if you have been affected by addiction, no matter what part of it you have been affected by, I see you, and you're important, and you're valued, and you're loved. Now, I wanted to talk to you about being able to persevere during the times that like we're going through right now. The past 6 months have been crazy. I mean, I don't think that anybody was prepared to go through a pandemic on top of a pandemic. We already have been experiencing an opioid pandemic. And on top of that, now we have the COVID-19 pandemic, and the recovery community has suffered greatly. People haven't had access to in-person meetings, to be able to fellowship with people in person, to be able to hug people, to be able to get that camaraderie. And it's essential to the survival of somebody who is in recovery, whether it's a 12-step meeting or whether it's a support group or whether it's church. It's difficult, and not being able to have that has been a struggle for many people. And if that has been you and you are still here, I just want to say how proud I am of you, because I wouldn't expect many people to be able to go through something like this while trying to recover from addiction. It's hard. And I wanted to kind of go back to what John Gehagen said about, you know, if you have struggled with something, or if you have experienced great pain, that the best thing that you can do is to find purpose. And that is something that I really try to hone in on with people that I work with and with people that I meet. I want to help you understand who you are and why you're here. And so even when your lifeline, like being able to go in person to a recovery meeting, has been severed, that you are able to, because you know who you are and because you know why you're here, that in the middle of your recovery, you can be thankful and positive about the Zoom recovery meetings that happen, and be resourceful and help come up with new ideas to navigate through this together. The recovery community has rallied through this experience together to try to make sure that there is a meeting no matter what. No matter what, there's a way to meet, whether it has to be virtual or it's 6 feet apart in a circle in somebody's driveway. The recovery community has been able to do that. And I want that to give you some hope today, because while things may seem grim and may seem hopeless, there is always hope. And when we look for who we are as people and who we can be towards one another and what we can give, that's our purpose. When we know who we are and we take that and we use our pain and we use our experiences for purpose, it changes the world. You have the ability to make a huge, lifelong, lasting impact just by being who you are and leaving people better than the way that you found them. And I think that people take for granted how even a smile could change somebody's day. Even a simple hello could change somebody's day. A quick text to somebody you haven't spoken to in a while. Hey, I just wanted to check on you. You don't know what somebody else might be struggling with, and you don't know what other people are going through. But you can imagine, because you can remember things that you have gone through. And if you keep that perspective in your mind at all times, then you have the ability to show compassion at all times. And I think that that is what is going to get us through these times like COVID-19, where we have limited access to each other. We have cell phones, we've got the internet, we've got social media. Let's use these as tools for good. Let's not weaponize these anymore. Let's not bash each other. Let's not put each other down for our differences in political views. Let's find common ground and unite together and navigate through this together. I'm so thankful to know that most people that I know in recovery are already doing this. And I want to challenge those of you who have not yet tried to figure out how to please do that, because you can make a difference just with a phone call, just with a text, just with asking a simple question. You can open doors, you can make things happen. I know that for me, every time I ever know, I found a way around it. And you can too. And there's nothing that can stop you except for yourself. So I want to, again, thank you for allowing me to be with you tonight. Thank you to Debbie and Kathy for, again, putting on a great 4th year. This has been just an awesome tradition to be part of. I'm just so thankful. If anybody could use any support, or you are interested in learning more how to help a loved one, you can go to hopesoldiers.com, but there will be resources shared later. We're now going to go into a section to talk about the kind of support that we've gotten for our leaders in the community, because during COVID-19, we've had to really rely on the leadership from our local government and our state government to kind of tell us, like, what's our next move going to be? Like, what do we do? Where do we go from here? And thankfully, we've had some pretty phenomenal support from leaders, and things are changing and improving all the time. And I just, I want to thank anybody that's in local government or state government for helping where we're at right now, because I know that it's a really hard job. And so give me just 1 second. We're going to transition over to local state support. I want to talk about the things that we have been able to do with their help. So I wanted to kind of share some pictures with you guys, because they mean a lot to me, and I know that many of you will be really thrilled to see some of these as well. This first picture is just outside of Snohomish County Courthouse and Snohomish County Executive Dave Summers' office. I want to thank Dave Summers' office for being willing to issue a resolution about Overdose Awareness Day, and the Snohomish County Council for being willing to do that as well. I also want to thank them for lowering the flags today at half mast, because this is to remember those who we have lost, and those who we're still fighting for. I also want to thank City of Mukilteo for being willing to do the same thing. Not only did they lower the flags, but they also issued a proclamation to declare today as Overdose Awareness Day. So did the state of Washington. So I want to thank Governor Inslee for updating his proclamation on Overdose Awareness Day. And I want to thank Tony from the Washington State Healthcare Authority for helping make that happen. This was definitely needed. This hadn't been updated since 2013, and obviously a lot has changed since then. So I'm super grateful to be able to share this with you today. And here are the proclamations from Mayor Gregerson with City of Mukilteo, Mayor Smith with City of Lynnwood, Mayor Franklin with City of Everett, and Mayor Thomas with City of Monroe. Really appreciate everything that has happened, and all the support that we've gotten from local and state government in honor of Overdose Awareness Day, and those we've lost and those who we're still fighting for. And with that being said, I am going to introduce Executive Dave Summers. Give me just 1 second so I can figure out how. Dave is joining us by phone, and I just have to find his number on here.
he was having technical issues, but that's okay. We're just glad he's here.
Hello, can you hear me? Can anybody hear me?
Yes.
Is that you, Dave?
Excellent, sorry. Yes, it is. I
Okay,
had been
thank
muted
you,
by the
Dave.
host. Sorry about that. I wish I could join you through regular Zoom, but my internet has been down all day. So just really want to thank you for the opportunity to be with you all today and to talk for a few minutes. So this is the fourth year we've gathered to raise awareness and listen to stories of those who have suffered and of those who we lost. And, you know, we know substance use disorder is a disease that's throughout our community and really affects every part of our community. And I've had close members of my own family suffer from this disease, and I've seen its damage up close. I've also seen the difficulties of families who feel the stigma or feel like there is stigma associated with it. And especially when there's no obvious help, and when they do reach out, there's little help. And so we know we can work together to really end the stigma of addiction. We really have to do this by actively supporting individuals and families in the midst of addiction, and by helping those who are ready to get treatment and accept services. And Robert and other speakers have mentioned there's no shame in substance use disorder for families or individuals. It can strike anybody. There's many paths to it. Drugs are incredibly addictive, and we must realize we've heard of the wonderful senses of humor and great intelligence and just the wonderful people that have been taken by drugs and who are in the midst of this. So we've got to recognize that. We've got to focus on the individuals and reach out, get help, and help each other. So in 2019, we lost 153 people in Snohomish County to an overdose, and I'm sure that number is low. I'm sure there's many others who suffer from alcohol addiction that are probably not in that number. And in the first quarter of this year, just through March, we had already lost 40 community members. So we were on track to have more people lost this year than last year. We've also learned that addiction is a disease that really thrives when individuals are in isolation. So we are seeing steep increases in the number of people impacted by addiction during this pandemic due to the social distancing, stay-at-home orders, loss of employment, and the many other stresses that we're all feeling through the COVID pandemic. So it's especially difficult times. So while we know there's a lot of work we need to do, we also know there's hope. And I'm committed as county executive to ensuring that Snohomish County continues to make services available through such programs as our law enforcement embedded social worker teams, the Carnegie Resource Center, and the Diversion Center. But we can't do this alone. Everybody has to pull together. It's really vital to maintain strong partnerships with community-based organizations and treatment providers. So thank you for your partnership and partnerships. We've got to do this together, and we need to strengthen our work together. I also wanted to just briefly thank the first responders in Snohomish County. Last year, they saved 642 lives through the use of naloxone. Think of that, 642 lives. And this year, they've already saved 413 lives just through the month of June. So again, a number greater than last year through the first 6 months. So whether you're somebody that is an active addiction or recovery, a friend or family member of someone struggling with addiction, or have lost a loved one to an overdose, please know we are all allies in this struggle. We have got to act as family, and Snohomish County is committed to helping reduce the stigma associated with addiction and providing those services to help those who are struggling. So again, thank you so much for putting this on for the 4th year, and thank you so much for allowing me to join you this evening.
Thank you so much, Dave. We are going to now share a video from the Snohomish Health District. We were fortunate enough to be able to work with them again. Thank you so much. We're going to hear from Dr. Spitters and then Kyle Wensing for the data and trends in the county, and then some resources.
Thank you for coming together to raise awareness and reduce stigma so that we can talk about opioid addiction without shame. There should be no shame or guilt in asking for help, and that's why events like tonight are so important. Even with an all-hands response to the COVID pandemic occurring, the Snohomish Health District continues to work with Snohomish County and other partners to move forward with critical work focused on opioid use prevention, treatment, and recovery. Some may have seen that we recently unveiled new hubs for opioid data in Snohomish County. The portal on SnohomishOverdosePrevention.com shares data around 4 primary categories: overdoses and deaths, community impacts, treatment and recovery, and usage and prescribing practices. It will continue to be an evolving dashboard with data inputs being shared by multiple partners involved with the Multi-Agency Coordination, or MAC group. Unfortunately, this new data shows an increase in people dying from opioid overdoses here in Snohomish County. There were 113 opioid-related deaths in 2019, but in just the first 6 months of 2020, we've lost 105 people to drug overdoses, 86 of them due to opioid overdoses. The majority of opioid overdoses in Snohomish County involve fentanyl and related synthetic compounds. We know that COVID has changed so many things in our community, and that includes the ability for people struggling with substance abuse disorders to seek health services and access to treatment. There have been some federal and state changes made to help streamline processes for telehealth and connecting to medication-assisted treatment programs. But we also know there is more to do. That is why we are grateful for ongoing partnerships with the MAC Group and resources from the Washington State Department of Health, the Federal Centers for Disease Control and Prevention, AmeriCorps Vista, and the Federal Health Resources and Services Administration to continue this important work. But we are also incredibly fortunate to have so many people and organizations in our community championing efforts to connect people to resources and to reduce the stigma around substance use disorder. We extend our heartfelt gratitude to the Lee and Warfield families, Lindsay Arrington, and all of the people that made this event possible. From their loss and suffering have come strength and hope for others. Now more than ever, there is an urgent need for a connection, physically distant, of course, but a connection to people, resources, support, and hope. Chemical dependency and addiction are a medical diagnosis, not a moral problem. Safe and effective treatment combining medications with counseling and behavior modification work. Please join the Health District and Snohomish County in opening our minds and hearts to people suffering from this condition, freeing them from fear of rejection and stigma, and lighting a pathway to recovery.
Hello, my name is Kyle Wansing, and I am a Healthy Community Specialist here at the Snohomish Health District. We at the Health District are extremely excited to be part of this amazing event, and I am excited to share with you a resource we created just for this event. Last year, we hosted a resource fair where organizations from the community offered information about their services they provide to everyone in attendance at the vigil. Since we were unable to gather in person this year, we have decided to create a virtual resource fair that offers that same opportunity to learn in an online format. This is a chance to gather information for yourself, your family, or a loved one. This resource is available now and can be found by heading to snohomishoverdoseprevention.com. Once on the page, look for the Resources tab here at the top. In the drop-down menu, you will see a tab named Virtual Overdose Awareness Visual Resources. Select that and you are into our online resource fair. You will see each organization is listed along with a small blurb about their services, a link to their website, a short description of how their services or hours have changed due to COVID-19, and an ability to download pamphlets and brochures. This page was specifically designed to offer those same resources that were available last year in person in an online format. However, the Snohomish Overdose Prevention website also has another resource for finding treatment and support. This can be found by going to the top of the page and looking for the tab labeled Find Treatment or Support. This page offers an in-depth look at the resources available in Snohomish County and includes the organization's contact info, a short description of their services, and the types of insurance they accept. These two pages offer a great starting point for finding treatment or support for either yourself, a family member, or a loved one. These pages are available now and will be shared with attendees on the Facebook page for after the event. Thank you all so much for attending this very important event. We hope that you all take some time to visit these pages and find out some information about all the amazing organizations that are doing work in Snohomish County.
Okay, I guess we start over. Okay, we've had some technical difficulties, so forgive us for that. We hope that this evening has given you some hope and encouragement on how you can empower yourself to take immediate action in breaking the cycle and changing the stigma of addiction. We'd like to increase the compassion, empathy, and reduce stigma as a community towards anyone who's currently dealing with substance use, anyone who's lost a loved one to substance use or overdose, and to increase the conversation around overdose prevention and around substance use. Actions that can be taken might be learning more about the science of mental health condition and substance use disorders, connecting others who have misconceptions about substance use disorders and mental illnesses, and supporting treatment and harm reduction for people affected by substance use disorder like methadone and Suboxone. Lastly, think how you would like and want your loved one treated if you found yourself in our position.
Each year, I reflect on the success of these events, judging by how many attend, and I have conflicting feelings. On the one hand, it feels good that more and more people attend, and that seems successful. And yet my heart breaks that there are more that attend because addiction has touched their lives, or even more that there exists a need at all. This year, I looked back on my first call to action when I said, I charge each and every one of you to get informed, talk about this epidemic that is devastating our families, friends, and society. It is time to change the negative stigma of addiction and save lives. I know we are slowly being successful. Although entities like Snohomish County Health and Snohomish County Health District and Snohomish County are the cornerstones for change, you can make a difference and make a change too. You do not need to be rich, have a degree, or be famous. It takes passion and time. Individuals like Lindsay Arrington, who got a declaration to have the flags lowered to half-mast today in honor of Overdose Awareness Day, or Brady and Amy King that own PalletShelter.com and SquarePegsSeattle.com, hire and invest in people actively engaged in recovery and reintegration, or Gretchen Sari, who saw the need and started a grief group after her second son passed, or Debbie and I, just two moms, sharing our stories and honoring our sons to change the negative stigma we felt about our adored sons, are making a difference and making a change. Thank you everyone for coming tonight. We have a few thank yous that we'd like to say. First one is, I wanna say thank you to Dave and John for being brave and telling their stories. Your voice and bravery will bring change. This was difficult, I know. Caleb Linder, thank you for the labor of love and producing all of the videos tonight. This has been foreign territory for us and would have been a huge learning curve. Thank you. Thank you to Snohomish County Executive Dave Summers and staff for speaking and supporting A Night to Remember, A Time to Act these past 4 years. Your continued support is very much appreciated. Heather Thomas and staff of Snohomish County Health District. You have not only supported our mission, but have encouraged and included us from day one. We cannot thank you enough.
And Lindsay Arrington of Hope Soldiers, thank you for being a voice and jump-starting this year's event, because Kathy and I would not have tackled an online event, so thank you very much. Your vision of encouraging hope is infectious. And Kathy, I feel our paths were meant to cross, and I know Corey and Spencer's stories are having an effect on the community. Thank you for walking down this path with me. And next we're going to go into Okay.
I have a thank you to
Okay.
Debbie too.
Okay, thank you.
Debbie, thank you for your partnership in putting on this event. I know our boys are proud of us. We've talked about this lots of times, and I know in the beginning it was very difficult for both of us. I know that they are honored that we are friends and honoring their lives and their deaths. Thank you.
Thank you. And we're going to have a moment of silence, followed by a video.
In loving memory of Sean Gehagen.
Spencer Warfield, I'll love you forever.
In loving memory of my wonderful son, Spencer.
For Spencer.
Stellar family remembering Spencer George Warfield.
Playing this for my cousin Stacy.
This is for Nick Moranti and Elena Chin. Rest in peace.
For Corey and Hayden. In honor of Corey Lee.
Love and miss you every day, Corey.
Miss you, Adam. Miss you.
I miss you, Corey, so much, and I wish you were still here.
I miss Corey and I wish he was still here.
Corey, I love and miss you so much.
Corey Lee, we love you and we miss you.
Love and miss you, Corey, in your honor.
Love you, Corey. Miss you.
Corey Lee. This candle is lit in honor of Corey Lee. We miss you, Corey.
In memory of Corey Lee.
Okay, and we'd like to thank everyone who attended through Zoom, and thank you for putting up with our challenges. It was a learning experience this year, and we just hope that next year that we can do our 5th annual, maybe back live. And we loved all the videos, and we had asked the community to send in videos and hope to ban next year. Great. So we're going to have Lindsay now do the Serenity Prayer.
Love you, Lindsay.
God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference.
I'm all tired from work now. Oh, fuck that.